As students get settled into yet another year at Queen's, all the while catching up with old friends and making new ones along the way, many can experience feelings of sadness, loneliness, and isolation. This past year at Queen's, we have made great strides in mental health initiatives. As a result of the growing pressure placed on administrative staff and specifically Principal Daniel Wolf, our student body has turned discussion into action. To find out more about the progress that has been made and what's to come in the future, Queen's TV News reports. In September 2011, Principal Daniel Wolf created the Principal's Commission on Mental Health as a response to demands made on campus regarding the need for greater mental health awareness and advocacy. We spoke with board member Roy Jacan to gain some further insight regarding the initiatives that have been implemented on campus.
Well, the Principal's Commission was created to assist the university in developing a mental health strategy and ultimately, to support students and faculty. Okay. Well, what we've been doing is sort of for the last year, weekly, we've been meeting and we've been hearing from student groups, from faculty groups, from community groups about different ideas, different insights into how Queen's can improve its mental health strategy. I mean, we've received very positive input from the community. We've received from student groups, from staff, and from faculty groups. And they've indicated some things that they thought that we've done very well, and some areas where they would like to see some adjustments, and that's something that we take very seriously.
We also spoke to Dr. Heather Stewart, the Mental Health and Anti-Stigma Research Chair here at Queen's. While she was away from her office, we were able to speak to her by phone. She informed us of Bell Canada's funding program for mental health. Bell contacted Dr. Stewart about implementing a $1 million contract for a 5-year commitment on anti-stigma research. She stated that the sooner we identify and treat this underlying issue, the sooner the recovery trajectory will be. Furthermore, when asked about the university's advancements in mental health, Dr. Stewart states that Queen's is making great strides by prioritizing mental health as an issue that must be focused on. She states that the most crucial step is to recognize that mental ill health is a problem in every workplace setting, and in order to achieve organizational objectives, it is important to do things to improve the mental health of our students, faculty, and staff. Last year, QTV News had the opportunity to interview Eric Windler at the Queen's Wears Green event. The Jack Project has sparked a great deal of publicity around the subject of mental health and continues to do so. We were fortunate enough to speak to Eric again during his visit to Kingston. Not only was he in town to celebrate his Commerce 82 reunion, he was also here to raise money and awareness for mental health.
Last year was an incredibly busy year. We did what we said we were going to do. We raised some money. We did some really cool investments with Kids Help Phone in terms of technology for young people to actually be able to reach out and chat to counselors using their mobile device or their laptop. My time was mainly taken up with outreach workshops. So we did actually 103 student, parent, and educator workshops across our various 36 high schools, colleges, and universities. We're coming to participate with Queen's to where the issues are, and that's on the campuses. And we're really hopeful to work with Queen's to lead best practices so that all across the country, high schools, colleges, and universities can use what we're finding out to help the students there. I'm an 82, I guess everybody's figured that out, and our 30th is this right now. And about 4 months ago, the leaders of initially the arts faculty got together and asked me if they could raise money for the Jack Project because they liked what we've been doing in mental health outreach.
Justin Scanney is a 4th-year student at Queen's who acts as the official liaison between the Jack Project and the Queen's student body. We caught up with him at the Alfie's event as he was coordinating student volunteers and making sure the night ran smoothly.
Just learning about mental health throughout the day, I had no idea it was such an issue. And the more I worked with Eric and the more I learned about it, the more I realized that if I was this uninformed about such a serious issue, there had to be so many more students out there like me. I think initially, when I first started, it seemed like a discussion that just never happened. It never came to the forefront. But I think after Queens Wears Green is when it really started to turn a little bit, and more people started to discuss it and realize that it's okay to talk about these things. You should be able to go to your friends, go to your peers, your parents, the peer support center. You should be able to talk to people about this stuff. And even it got just houses that, even if they haven't suffered mental illness in their house, they got them talking about the event. It got them talking about this huge issue that we're facing right now. And I think, yeah, as I mentioned earlier, it's an issue that everybody deals with. Everyone faces stress. Everyone has those exam months that are absolutely crazy. Everyone has 1,000 things on the go throughout university. And we're really young. We haven't had to cope with stuff like this yet. Hands down, it's okay to talk to somebody. It can be anybody you feel comfortable with, whether it's a friend, a parent, even a prof that you know. It's just, you have to get it out there. You have to talk to somebody about it, because if no one knows what you're going through, then it's very difficult to get help.
Evidently, previous criticism towards Queens' stance on mental health has not gone unnoticed. As a supportive community, we have come together to tackle this issue on our own. There must be a continual push to create mental health practices that are both effective and immediate. Destigmatizing mental illness is also a top priority. Queens is taking the necessary approaches to create an informative, healthy, and safe future. This has been Sarah Turnbull reporting for QTV News.